my name is Ariana. Today I'll be doing a IV medication BI mini pack. Before I get started, I will look at my physician's orders for the right drug, right dose, right route, and the frequency of the administration. And I will also assess my patient's lab results and look for any allergies they might have. Okay, then I'm going to move on. I'm going to grab my medication, and today I'm going to be doing 0.9% sodium chloride, which is just normal saline, and the purpose of it is to keep my patient properly hydrated. And I'm going to look at my bag to see for its integrity, to see if it's intact and has not been tampered with, and if it is up to date, and it sure is. Then I'm going to take my label, and I'm going to have my patient's name on it, along with the drug name and the rate at which it's going to be administered, and the drops per minute. And I'll have my my date and time and my initials. Go ahead and label my sodium chloride. And then I'm going to go ahead and take my tubing, and I'm also looking at the integrity of the package of my tubing, and it is intact. It has not been tampered with. I'm going to go ahead and take my tubing out of my bag. And at this time I'm going to go ahead and spike my sodium chloride. Go ahead and hang it right up. And I'm going to clamp everything. And it is primed. Go ahead and hang this right up. Before I do anything, I'm going to go ahead and perform hand hygiene. I have forgot to mention that I will also label my tubing with the name, with my initials, the date, and the time. And so now, once again, I'll go ahead and perform hand hygiene. I'm going to go ahead and place my gloves on. Okay, there we go. And take my 10 milliliter syringe, and take my 22 gauge needle, and put in 6 milliliters of air. Okay. That wasn't supposed to happen. Okay. Before I do that, I'm going to go ahead and look at my normal saline and see if it is up to date, and it has been tampered with, and it is intact, and it is also up to date. Now I'm going to take my alcohol pad and clean my vial. Now I'll take my syringe and put in there the 6 milliliters of air, and then draw up 6 milliliters of normal saline. Okay, try to flick out any bubbles that may be in there. Okay, I'm gonna fish for my cap and throw my needle into the sharps container. Okay, at this time I'm gonna be in my patient's room, and I'm going to introduce myself to the patient, and I'm gonna ask the patient for their name, and I will make sure, and I will take their name and look against their wristband and my MAR and see if that checks out, and it does. And I will explain to the patient why they're getting these fluids, to let them know that the purpose of it is to keep them hydrated, and it will be 17 drops per minute. And also I will assess my patient, ask my patient if they have any allergies that they know of. At this time, I'm going to go ahead and look at my IV insertion site. Notice that there's no phlebitis, infiltration, redness, or edema. And I'm going to go ahead and check the patency of my IV insertion. And first I'm going to go ahead and clean the port. Unclamp. And then I'm going to go ahead and aspirate. I see blood, and press 3 push in 3 milliliters of normal saline using the push and stop method. Okay, I'm using the positive pressure. I'm gonna clamp this back up and take off my syringe. At this time, I'm gonna take my tubing. I'm gonna clamp it before I put it on my patient, just to make sure that I do get the flow rate going and that there's no bubbles in it. And it's going. Just clamp this right back up. This time, I'm also gonna clean the port one more time. Clean this too for safety precautions. I'm gonna let everything. I'm gonna unclamp everything just to make sure my patient's getting their fluids. At this time, I'm also gonna establish their flow rate for a minute, and it is 17 drops per minute. Okay, and I'm gonna let my patient. I'm gonna let this run, and I'm gonna come back and check periodically. And I will make sure to ask my patient if they're okay, if they're still doing fine, and my patient is good. So I'm going to go ahead and take off my gloves and be right back in 15 minutes or so. Okay, now I'm back into my patient's room. Before I get started, I will perform hand hygiene. I'll go ahead and put on my gloves, and I will ask my patient once again for their name and date of birth, just to be re-identified. And of course, I'll check that with my MAR along with their wristband. Okay, and I will notice that their normal saline has stopped and it's over. So I'll go ahead and clamp everything, including my clamp up here. I'll remove this, and I'll hang this. I'll make sure to put a alligator port on it, to hang it up so the other person can use it for other drug administration. Okay, at this time, I'm going to go ahead and clean the port so I can put the rest of my 3 milliliters to check my patency of my IV insertion once again. Clean the port, take my syringe, I'll make sure to unclamp, and then aspirate. I see blood, and then using the push stop method, push the rest of the 3 milliliters in there. Okay, and using the positive pressure, I will clamp this right back up, and I'll remove this. Okay, at this time, I will make sure to look at my patient's IV insertion site to see if they've had any adverse reactions to the medication, so to the normal saline, and to see if there's an infiltration, any phlebitis, any edema or swelling on the site. And then I will make sure, if my patient need be, I'll make sure to clean my patient up. Okay, at this time, I will make sure to address that if this was a central line, I would flush heparin instead of normal saline. And I will also need to document. The date, the route, the dose, the frequency, and the medication that was being infused. And I will also need to, and also the time. And I'll need to check my patient's site, which there is no phlebitis present, there is no phlebitis, no infiltration, no redness, no swelling. And I will also need to monitor intake and output, which their intake was 100 milliliters per hour of normal saline. And of course, before I do leave my patient, I will make sure to assess for the 4 Ps, make sure my patient is in no pain, make sure my patient is in a comfortable position, and also make sure that my patient is has all their personal belongings, and if they need to go potty, for them to go potty. Before I do leave, though, I'll make sure to dispose of everything in the sharps container and in the garbage. And I believe that is it.